Hello, Dr. Rahav.
Hey, Dr. Gruttadauria, how are you?
I'm great. How are you?
I'm great.
So, tell me about yourself.
So, I'm a medical doctor, and I'm a doctor of internal medicine. I'm also board certified in hospice and palliative care. And importantly, for the purposes of our conversation today, I'm a doctor of functional medicine, just like you.
What is functional medicine?
That's a great question. Functional medicine is a new paradigm for healing that incorporates so many facets of the whole individual, but in a nutshell, genetics, environmental exposures, diet and lifestyle, and examines these in the context of health imbalance, of disease, and clarifies the constellation, the way those aspects of each individual interact to lead to health imbalances. Another easier way of saying that is root cause resolution. So we're looking for the root cause processes that are driving health imbalances, address them to heal disease from the root.
So I'm always fascinated by the fact that you have this traditional medical training and then you made this total shift into saying, this is how I'm trained. I'm trained to look for, identify disease and treat disease. But what I'm realizing is that I need to be looking at how can I identify causes and treat those? Where did that happen for you?
That's a really great question, and be
I
ready.
I only ask good questions.
Be ready, because I'm going to flip it around right back at you. Okay,
right.
So great question. For anyone who's trained in medicine, I think that we can all identify with the profound suffering that we experience. Human suffering. We certainly are exposed to that in hospital medicine, where people are out of balance and they need that close monitoring that hospital stays require. And we are wonderful at managing an acute situation. IV antibiotics to cure infection, steroids to reduce a pain flare and an inflammatory flare as an autoimmune disease, such as rheumatoid arthritis, such as Crohn's disease. If someone's lungs give out, we can ventilate them. If someone's kidneys give out, we can dialyze them and support the body in a crisis, which is amazing and miraculous. However, when those people get discharged from the hospital, those humans who are suffering, and we get them into a balance, we want to ask, well, why do they have autoimmunity? Why do they have Crohn's disease? Why do they have respiratory failure or kidney failure? And the tools that I was given as a medical doctor to answer those questions sadly are few. We can understand the pathways by which dysfunction happens, but not the root cause. I think the calling in that all of us who become care providers, no matter what our profession, chiropractic medicine, allopathic medicine, nursing, acupuncture, naturopathic medicine, there are so many aspects of healing, but the tools that I wanted, aspired to answer the calling of being in service and alleviating human suffering were not enough. They were amazing, and I was grateful for the tools that I was given, but I felt that there were not enough. And fortunately, I had the luxury of being exposed to other healing traditions, both before, during, and after my medical training. And I pulled from those, and I found that functional medicine was a systematic way to both substantiate the science behind those traditional methods and apply them in a very pinpointed, evidence-based way, and is really a way to collate, I think, from the healing traditions that you and I have been exposed to, and put them into a incredibly powerful operating system.
Love it, love it. So the why versus the what.
The why versus the what, even though the what is incredibly important as well.
Absolutely.
And how about you? So tell me about your pathway into functional medicine.
Okay. So I began my career many years ago as a chiropractor, and I still am a chiropractor. And what I realized was my initial foray into chiropractic was really all about sports medicine. Really, I was very much interested in sports injuries and working with athletes and so on.
And you have an athletic background yourself.
Yes, and then what I realized was that, you know, what I'm doing with people in rehab and so on is really affecting their nervous system. So then I went and studied with the Carrick Institute and went into this functional neurology training. So over the past 20 years I've been studying neurology and how the system works versus whether or not it's broken. And then it was just a natural move to start studying the biochemistry, which when I was in school and I was really interested in sports medicine, I really wasn't that interested in the functional medicine piece because I really didn't think I was ever going to use it. You know, biochemistry in my mind was just a class I had to take to pass the boards. But then, you know, now it seems like the majority of what we do is biochemistry. We're looking at constant, you know, lab work and so on. But I think that it's expanded even beyond that to look at, well, what does it take to build a human? What does the human body need? And trying to get back to this ancestral health, looking at, you know, how the body works and what its basic needs are and restoring that, because the body has this infinite wisdom to be able to heal itself. So I think that if we are able to identify in our patients, you know, what's going on with them, and then figure out what they have too much of and what they have too little of and work on rebalancing those things, I think that's where our success really lies. And the beauty of us working together is really like magic for patients that come here because they get, you know, so many different perspectives because of our backgrounds.
It's so interesting. I think so much of my training is focused on the biochemical, on the metabolic, and I have sought in my continuing medical education to learn more about the body, the physical body and the energy body, which is the focus of chiropractic.
Right. I mean, the idea of chiropractic is really to restore health and normal spinal function. But the underlying premise of that is that all of our joints and muscles drive the brain, and the brain controls and coordinates everything else. So, like, give me a hand, I'll show you. So, if this is up and this is down, close your eyes. Up or down?
Up.
You knew that because you felt it, right?
Mm-hmm.
But what that means is that the muscles and joints in your finger are hardwired to your brain. So, the more we move, the more our brain is stimulated, and the more appropriate its response will be to everything else that's going on in the body. Well, it turns out that these receptors are mostly focused in the spine. So if we adjust or manipulate the spine, it actually has a much more powerful effect than working on a hand or a foot. So when we look at working with people from the structural perspective and from this metabolic perspective, neurological, and also the mental, emotional, you know, because the mindset of health is really key, because when people get sick and they're sick for a long time, they just have an entirely different view of where they are, and you know, they become down and depressed and so on.
And what they're capable of.
Right, and you know, so I think it's incumbent upon us to really try to look at the person as a whole and help bring them along. And I think that's what they get when they come here, is that they get, you know, a partner in their health, not, you know, we're responsible for their health. We actually make them responsible for their health. But the beauty is that it's a great partnership.
Yeah, so I love what you're saying. I think what we're going to do is give some concrete examples of that. And so stay tuned. We're going to actually take this general approach to functional medicine, the operating system of functional medicine, and how different providers in functional medicine, such as myself and Dr. Gruttadauria, and apply it to case scenarios. So stay tuned.
Very good.